central nervous system stimulants, and related drugs. Stimulants are drugs that stimulate a specific area of the brain or the spinal cord. And also included in this category are some sympathomimetic drugs. First one, analeptics. These are used to reverse the anesthesia-induced respiratory depression. Now, we don't use it for this reason quite as often as we used to. But we still do use it for neonatal apnea, which is a form of respiratory depression. Common drugs include Dopram, but what you're going to see frequently is the aminophylline, theophylline, and caffeine. Second use, appetite suppressants. The word for that is anorexiant. Notice it's got anorexia in the word. It's thought to suppress the appetite control center of the brain. Third use, treatment for attention deficit hyperactivity disorder. It stimulates the areas in the brain that's responsible for mental alertness and attentiveness. Now, think about it. This is a hyperactivity disorder, and we're giving them a stimulant. However, these are usually children that have this. The drug tends to help them pay attention and be more alert and a little calmer, actually. Drugs for ADHD should be given at least 6 hours before bedtime to reduce problems with insomnia. And it may cause dry mouth, so frequent oral care is needed. It should be taken on an empty stomach 30 to 45 minutes before meals, and sometimes drug holidays are ordered where the person comes off the drug for a number of days. Parents should keep a journal to note their child's response to the therapy. This is a very potent drug with lots of side effects and implications, so the parents need to be writing down how is the child responding to this therapy. Fourth use for this drug is treatment of narcolepsy, which is it's just falling asleep. It's not because the person's tired. It's because something's going on in the brain and the person just falls asleep. So these drugs can be used to increase mental alertness. And the fifth use is for treatment of migraine headaches. And caffeine administered with other drugs is used in this instance. Now, caffeine has many uses. Yes, we use it for migraine headaches, but we also use it for neonatal apnea, respiratory depression in adults, and like we said with the migraine headaches, it helps to enhance the effects of analgesics. Excedrin is aspirin and caffeine. Caffeine is also used as a central nervous system depressant, like that's the NoDoz and the Vivarin. It's found in a lot of over-the-counter drugs, and it's also not unusual to find it in combination prescription drugs. And then we've also got all the foods and sodas that are sources of caffeine, so it needs to be used with caution. We need to do a good history, see what their diet's like, what over-the-counter medicines they're using, and then we also need to look into their medical history for peptic ulcers, recent myocardial infarctions, and dysrhythmias. Those are reasons to be very careful about this drug. Adverse effects. Well, there's a wide range of them, and they're dose-related. Think about what they're intended to do. They're intended to speed up the body systems. They speed up the heart. They speed up the brain. They speed up everything. So adverse effects are going to include palpitations, tachycardia, hypertension, angina, dysrhythmias. All of that is because of the speeding up of the heart. We're going to see nervousness, restlessness, anxiety, and insomnia. That's the central nervous system stimulation. We're going to see nausea, vomiting, diarrhea. Again, that's the GI implication, and dry mouth. Increased urinary frequency, and there are other adverse effects. So we're going to assess people like we always do with medications, possible contraindications, potential interactions, including herbal therapies. We're going to be looking for things such as abnormal cardiac rhythms. If they've got an abnormal cardiac rhythm, we probably shouldn't be speeding up the cardiovascular system. We should be looking for things like seizures, palpitations, and liver problems. And when it's used in children, we need to assess their baseline height and weight. Remember, this is a stimulant. We're giving it maybe for ADHD or something else, but we want to make sure we're not speeding them up so much that we interfere with their normal growth and they end up getting underweight. We're going to monitor for therapeutic responses and for adverse effects.